here at the St. John Clark Pain Treatment Center, and I wanted to elaborate a little bit about our topic for this month for Kids Day. So every month we highlight a topic on issues that affect children to educate you and empower you to understand about their structure and how neurosomatic therapy can help them overcome some of these issues. Now the topic this month is going to be dysfunctional gait patterns. Now gait refers to a walking pattern, and there's many reasons why children may have a dysfunctional gait pattern. It's important to understand that there's a neurological development that happens even before children begin walking. For example, in a crawling pattern, children begin to establish that cross pattern that we see later on in movement. And so if a child either doesn't crawl or has improper crawling, that may impede their proper neurological development, and that pattern may not be facilitated, and so you may find issues in their gait later on. There's baby devices that we use that may make life a little bit easier but may impede proper muscle development and coordination. For example, children that are in a walker for long periods of time may start leaning forward and kind of stepping on their tippy toes to move themselves forward, and that can create a pattern that's incorrect for them. If you put babies in a seat, sometimes for short periods of time that may be convenient, but if a seat is supporting their entire weight, that may impede their development of their back muscles to actually hold themselves upright. And so it's really important for them to have tummy time and to get that development of those muscles in place. So even when parents kind of hold their children's hand and walk in front of them, that's kind of leaning their weight forward. Of course, if you do that for just short periods of time, it's not going to really affect them negatively, but that continuous patterning that you're establishing and facilitating into their nervous system can create issues later on. Even with baby wearing, if there's an issue in the hip joint and the babies are not placed properly, that can impede proper gait later on as well. Some of the more common gait dysfunctions that we see, now we're talking strictly structural here. There are neurological components to gait. So if a child, for example, has autism, and we did a topic last month on how neurosomatic therapy can help children with autism, that has a neurological component, and that may be treated a little bit differently. Also anatomical, so if the child has a leg length inequality or hip dysplasia that's genetic and things like that, those are more anatomical, and those are treated a little bit differently, but we're talking strictly structural. Some of the more common ones we see, and I'm going to highlight them and show you some examples of that. So this is Gracie, and we're going to talk about some dysfunctions here. You have a really common one called toe in, toe out. Go ahead and put your toes in. This is where the leg mostly remains straight, but the toes come in or come out. Now that can happen unilaterally or bilaterally, meaning one side of the body or on both sides of the legs. Another one is tibial torsion, where the actual bone is rotating in the tibia here, or like a femoral torsion, where the femur or the thigh bone is turning in. Now those are things that are addressed by addressing the soft tissue. Now a lot of times children are kind of left alone until like age 5, but once they start becoming school age, this sometimes is addressed by surgery or casting of the foot. But because we understand that it's the muscles that move the bones, then we can address the soft tissue and really bring a lot of relief and a lot of balance to a child's structure. This function that we see is where the knees kind of bow in, right? We see that called bow legs, or bow legs actually is where the knees turn out, or knock knees where the knees turn in. You've also heard it called varus or valgus knees. And again, we can treat that by treating the soft tissue. Now, it doesn't really matter why the incorrect gait pattern was established, right? If the child is already in that pattern, really getting them out of that dysfunction is really going to preserve their knee joints, their hip joints, their ankle joints, and really lead them to a place of function and stability in the future. And so it's really crucial to address these things. Another common one we see is toe walking, and I'm going to show you a quick description of that. So toe walking is where the child lands on their tippy toes, and a lot of times this is because the posterior chain is really tight, so the calf, the hamstrings, and so they end up just walking on their tippy toes and facilitating this pattern. Okay, that's going to lead to high hip flexion and potentially some back pain in the future. And so addressing all of the soft tissue here on this posterior side is going to make a big difference and make sure that they don't create any tension in their low back and they're not prone to injury later on. And so we're excited to help your children kind of lead a balanced life, especially if they're in sports. If you've got your children in sports and they've got all of these patterns already established and they're incorrect, you really want to move them out of those places so that they can lead a more functional and proper and balanced life. And so thank you for listening, and if you have any questions, just contact us here at the clinic.